Hello everyone. Welcome to our webinar. Today is a special presentation because you have all joined us because you are committed to improving how you execute visual field exams in ways that will make your day-to-day operations easier, more efficient, ensure diagnostic accuracy, and create exceptional patient experiences. Now, those are huge goals, and we are excited to help you master them all. I'm Jessica Marabella, Content Marketing Manager for Virtual Field. And if you're not familiar with us, at Virtual Field, we provide accurate, high-quality visual field, color vision, pupillometry, and extraocular motility testing to empower exceptional eye exam experiences for doctors, patients, and staff. Just a quick note, this webinar is being recorded, and a copy will be provided to all registrants and attendees via email within the next few days. We'll also have dedicated time for Q&A at the end, so please feel free to submit your questions at any point using the Q&A feature in your webinar control panel, and we'll of course do our best to answer as many questions as possible. Now today I'm joined by two exceptional experts who are both former ophthalmic technicians turned technologists. Torri Thompson, MBA, is a Director of Customer Success at Virtual Field, where she supports accounts ranging from small practices to large enterprise organizations. With over 2 years of experience in customer success and account management, Torri is known for her deep product expertise and commitment to customer growth. Torri excels at turning complex concepts into practical, easy-to-understand solutions that empower vision care providers to get the most from their technology. Passionate about transparency, inclusion, and innovation, she is especially driven by building meaningful relationships and helping customers succeed at scale through empathy, collaboration, and integrity. Kristen Lemond, MAJ, is a customer success manager with over 7 years of clinical experience in the eye care industry. She brings a unique blend of hands-on clinical knowledge and strategic business insight backed by a recently earned master's in healthcare administration. Kristen has demonstrated success building strong, lasting relationships with clients. Her passion lies in enhancing the patient experience through innovative healthcare solutions, and she's deeply committed to helping providers succeed. Known for her collaborative approach and results-driven mindset, Kristen continually seeks new ways to lead, grow, and make a meaningful impact in the vision care space. Kristen is also at Optometry's meeting today in Minneapolis, so if you're there or will be there before the event wraps up, stop by the Virtual Field booth to meet Kristen IRL. And I'm going to place links to both Kristen and Torri's LinkedIn profiles in the chat so you can connect with them after the presentation. Now, in today's session, Torri and Kristen will discuss step-by-step workflows that top-performing practices use to integrate visual field testing into their daily operations as a component of their comprehensive eye care diagnostic routines, how to scale testing volume without adding staff, all while maintaining high standards of patient care, how to optimize reimbursements and generate new revenue streams through more effective testing protocols, and how to make visual field exams more comfortable, accessible, and efficient for patients to ensure satisfaction and test compliance. Throughout the presentation, you'll hear stories from Torri and Kristen's time implementing new technologies, from their days as ophthalmic technicians, and the best practices they've learned from supporting the testing needs of the over 2,000 clinics that use Virtual Field. Torri and Kristen, thank you so much. The virtual floor is yours.
Thank you, Jessica. I see in our audience today we have kind of a wide range of listeners. Some of us may be providers, maybe technicians, maybe some administrative staff. So I'm happy everyone was able to join in. I want to start by grounding our conversation today in some general understanding about visual field testing. Visual field testing is a crucial diagnostic tool in ophthalmology and optometry. It helps us map the full scope of a patient's vision, identifying areas of lost or reduced sensitivity, and it's vital for diagnosing and monitoring conditions like glaucoma, neurological disorders, and optic nerve diseases. It's truly fundamental for comprehensive patient care. Traditionally, these assessments have been conducted using tabletop perimeters. They're big, they don't move, they're maybe a little ancient in our offices. However, I'm not too surprised given the way virtual visual fields have really blown up. We've seen a massive and rapid adoption of virtual visual field models. They're truly helpful in kind of expanding and offering visual fields to patients across all different types of demographics and ages. I think we have a little video here just demonstrating just how testing can be conducted in the office. Um, to put it simply, there's a growing demand for visual field testing that's more accessible, portable, and efficient than ever before. The vast majority of the advice we're going to share today is applicable to practices, whether you're using a traditional tabletop or a VR headset. But of course, we truly feel and have seen optimization improvements throughout the use of more modern technology, and we're going to point these differentiators out today. So let's kind of talk about the ideal workflows for visual field testing at the office, as far as starting with the staff and then moving into the patient interaction level.
Awesome. Hello, everybody. My name is Kristen. I'm so excited to chat with you today. We're going to start to talk about the practical side and what your patients are going through when they come in for a exam in a visual field. From the moment the patient walks in, you have the chance to wow them. And today we're just going to highlight critical opportunities to streamline the entire process. So the first opportunity you have to make an impression on your patient starts when they check in. Patients can be somewhat impatient sometimes, and they want their appointments to start on time, which is understandable. When there's time between getting checked in and the pre-testing, and seeing the doctor, it can sometimes cause frustration in patients and impact whether or not they come back to see you. Everybody's time is money, and everybody's time is super important. So making sure that we're getting our patients in, we're getting them out while giving them well-rounded care is super important. So we're going to talk about different ways that you can improve the efficiency of the entire exam experience when visual field testing is part of the exam protocol. So a few ways that you can optimize your schedule is by staggering appointments. So avoid bunching appointment times that are similar or appointments that are similar. They're going to have similar testing being done. You don't want to book them all at the same time because you may only have one machine that can do the testing. Additionally, if you do have, multiple devices, so we have practices that use tabletops as well as VRs together, and that really helps streamline the flow as well. On that note, you can also make sure that you're allowing enough time for an exam. If someone is coming in for multiple exams, multiple scans, you want to make sure that you let them know ahead of time how long they can anticipate their appointment being, and make sure that you allot enough time for your staff and doctor to conduct all of those exams and do what needs to be done. Another thing that you can do is prioritize complex cases. So scheduling them earlier in the day when your staff is fresh, they're ready to go, they're alert, they first come in, and you can prioritize those appointments. You can also use block scheduling, so dedicating specific time blocks for specific types of appointments so that you're doing them correctly and you're able to get them in and out. You can implement overbooking strategically, account for no-shows. Not everybody shows up to the appointments that they book, but you also have to be careful of not overbooking yourself, because in the event that everybody does show up, you still want to make sure that you can get these people in and out in a timely manner. Lastly, you can use a wait list to fill canceled appointments. Some people cancel at the last minute, life happens. Having a wait list for those days will ensure that you're still able to keep your books full and keep your staff going.
Thank you, Kristen. We're going to talk a little bit about scheduling and checking in daily patient prep. So one simple but really powerful tactic to expedite the flow of patient exams is to kind of enter the patient information that you need ahead of time to administer the exam. So your staff can take either 5 to 10 minutes at the beginning of the day or at the end of the day to enter patient information such as their first name, last name, gender, and birthday. This kind of just ensures that there's a smooth exam queue process, and it can give the staff time back throughout the day to kind of do other staff duties or other office duties like answering the phone, filing charts, or just answering some telephone encounters. It kind of gives them, even giving back someone 3 minutes in the day just makes a world of a difference. And then next, we're going to talk about how to ensure the visual field tests themselves are executed smoothly and to a high degree of patient comfort and compliance. Of course, those are the 1 and 2 most important things. The absolute foundation of increasing patient test compliance when it comes to visual field testing is communication and comfort. I know that kind of sounds very fundamental and maybe a little elementary, but it's really powerful. When you're asking a patient to undergo visual field testing, don't just tell them that they need it. It really helps if you explain to them why in a way that resonates for them. Especially our older patients, they kind of go back and forth between doctor's office appointments and they're kind of just getting orders all day. You want to really take the time to explain to them why they need certain testing. It can kind of just change their feelings towards the testing. For example, if you just tell them something simple like this helps us catch early changes that can affect your driving vision. Maybe some of your patients are caretakers for their family, so that's really important for them. This will connect the test to their daily life and their personal well-being and really allow them to connect with the test and actually maybe want to do it. And then you want to set clear expectations. It's equally important to set clear expectations. They kind of do better when they know what's coming. You can use a script to walk patients through the test calmly and confidently. You can describe what the test involves. You can give them a ballpark of how long it will take and what sensations they may experience. You can say things like, you'll see blinking lights or flashing lights. It's normal to feel a little tired after. Don't blindside them with the test and just put the headset on them or put them in the tabletop. You really want to just explain things to them. And of course, some patients may have anxiety. You want to acknowledge that the test may not be their favorite. It may not be your favorite to administer to them, but just talking to the patient and just giving them a real human experience can make a world of a difference. You also want to give them space to ask questions. Don't just get them ready for the test and then just walk away right away. Give them a little time to adjust to the test and, address their concerns or any of the questions that they have. You also want to use a reassuring tone. We are busy, we do get flustered as technicians, but you want to make sure sometimes this is your patient's only interaction for the day outside of the house or outside of, their family. So you really want to talk to them in a way that's comforting and it's calm and reassuring. That also makes a world of a difference. And it helps your patients come back for repeat testing. If they have a negative experience, if you talk to them in a certain tone, they're not going to want to come back for testing. And then lastly, you want to confirm their preferred language. Our headset does have about 42 languages on there, which is really awesome. If they're not really aware of how to take the test, if it's in a language that's not their primary language, they may miss essential information, and that's not going to give you the results that you need. Like I was saying before, the headset does have 42 languages. On the actual user interface, it's telling you what the headset is saying. So for your patients with auditory issues, you can just have them read the instructions there, but it does make a world of a difference if you're giving them the instructions in a language that they understand. And it also helps your technician not have to sit and explain every single thing the headset does talk to them. And now we're going to talk a little bit about where you're implementing the visual field tests. If you have a standard tabletop, there's sometimes if you're in a smaller office, maybe you only have one lane for the exam and then you're using another lane for the actual tabletop itself. So you're really confining your testing abilities there. If you're utilizing any of the virtual visual field machines, we recommend being thoughtful and intentional about where you're conducting your pre-testing. This can make testing more quick. It gives the doctor more time to actually review the reports, and it kind of moves the patients through the exam process quickly. They're not waiting for one room. You can really test anywhere in the office. We've seen customers have great success conducting visual field testing in pre-test rooms. Maybe they still have a dedicated room. I was just on site with a customer a couple days ago, and they did the exam in the actual lane in the exam room. They kind of leaned the patient back in the exam room chair, or you can even do it in the waiting room. You can do testing anywhere in the office. You're not confined to one room. We even have customers that have multiple virtual field headsets in their practice. The technician really can bounce around and administer multiple tests at once because the entire system is portable. So you don't need one dedicated technician for one patient. You can have your technician multitasking for multiple tests. And regardless of the model that you choose, the flexibility to test patients in various locations, you're not having a dedicated dark room. You can really utilize your office space. And especially for your glaucoma patients, having a portable option like this, it will help them just stay on routine. And it's less intimidating, and it's way more convenient for the staff and for the patient. So we do have a quote here. It says, the biggest negative impact of having one Humphrey was that I was booking glaucoma patients 6 months out for their routine scheduling. That is way too long. They should be seen every 4 to 6 months. So a 6-month lead time was unsustainable. The real ROI is that now we can conduct more visual fields every day and keep our glaucoma patients on their routine testing schedules. I'm sure we're all familiar with your patient getting off track, especially during COVID. You probably saw your patients coming back and their conditions are worse. It is really essential and crucial for those patients that are on treatment to stay on schedule. And this is just a testament. This quote is just a testament for how our customers feel about having that portable option and being able to keep their glaucoma patients on schedule and moving from a traditional tabletop to our visual field method. The portability means they can create additional exam lanes, and you're doing it more affordably. You're not shelling out tens of thousands of dollars to invest in another tabletop.
Perfect. Now your exam is complete. So what's next? Your technician should immediately process and transmit the results to your central patient management system, or they can go directly to the doctor's review station. We've seen practices who bulk upload their reports to their EMR or EHR once a day, and that works for a lot of people, but we always recommend that uploads happen routinely just for ease of future patient record access. The doctor can then access and evaluate the visual field report in real time, and oftentimes this is happening before they enter the exam room to speak with the patient. This entire process ensures that the patient discussions are informed by the most current data, which allows for immediate diagnosis, treatment planning, and personalized patient counseling. This streamlined flow fundamentally avoids frustrating patient handoffs and backlogs that can typically plague a busy clinic. So we've all been in a clinic where things are just running haywire, and having those immediate results really just helps things go by a lot faster, and the patients are a lot more satisfied knowing their results as soon as possible. Now we're going to talk about the foundational elements of improved visual field testing, which is patient compliance. As we talked about previously, the testing environment plays a huge role in patient compliance, and a huge factor in non-compliance is test discomfort and anxiety. When patients expect that they're going to be stressed or they're doing an exam that they don't particularly love, sometimes they'll procrastinate, push it off, be like, oh, I'll go next month. Next month comes, like, oh, I still don't really feel like doing it. And they can get really off of their testing game and really push, their progression and things like that. Communicating around what to expect during the exam, like we mentioned earlier, making them feel comfortable, just creating that testing environment that brings them comfort is so important. Okay, so what you're seeing here now is a Reddit thread from a real patient expressing anxiety about the visual field testing process with a traditional tabletop thermometer. Basically, what they're saying is they've developed a serious phobia of eye exams, especially the field of vision test. At their last visit, they had a panic attack, burst into tears. and the field of vision test couldn't be completed. They have their next scheduled and they are super nervous about it. They heard about VR testing and they basically came on here to see what the word was. They wanted to know if anybody else had done it before, if it was easier on the patient. And so they were looking to get some more information. If you're struggling to keep patients on a regular schedule with their testing protocol and you know it's due to anxiety around a tabletop perimeter, you can add virtual visual fields to your diagnostic equipment to help with those anxious patients. We have many customers who choose to keep their traditional perimeter in one location and also have virtual field just to accommodate patients with anxiety and additionally accommodate patients who are unable to get into a tabletop. I mentioned the virtual modality being a preferred option for anxious patients, but it can also be better fit for the older adults. Like Torri mentioned, we have practices who recline their patients, have them sit back and relax, kick their feet up while they're taking a visual field. That's not something you hear commonly. A big issue with these exams is not even really the exams themselves, but the position that the patient has to be in for an extended period of time. Sitting chin and forehead all the way forward is almost the entirety of your whole exam. When you're getting your refraction done, when you're getting your slit lamp exam, everything you're doing in that office is chin and forehead all the way forward. And that can be really exhausting on your body. And so giving them a chance to kick back and take a visual field exam in a more relaxed position does help a lot with the exam experience. All that being said about anxiety reducing benefits of VR versus tabletop, regardless of which device you're using, you can still optimize compliance by making sure that the area is quiet, free from distractions, comfortable, make sure they have comfortable seating that allows patients to sit in the positions that they need to without being strained. This might seem like such a small detail, but it really does enhance the patient's ability to focus and complete an exam successfully when you consider the overall feel of the room and making sure that the patient is comfortable in their testing space. Beyond the technology itself, empowering your team is such a strong practice. Your technicians are essentially, the engine chugging along throughout clinic, and making sure that they are trained properly and know how things are flowing is going to make sure that things are going by as quickly as possible. So empowering empowering your staff and training them is a non-negotiable. Technicians need to be fully trained and proficient in the testing equipment that you have in your office. A confident tech instills confidence in the patient and ensures that they provide consistent, clear instructions for every single test, perhaps even role-playing challenging scenarios as part of their training and onboarding process. Enable technicians to recognize compliance issues. So train your staff to recognize issues in real time, such as patients being fatigued, getting distracted, not understanding the way that they're supposed to be doing the exam, so that you can intervene or your technicians can intervene effectively and make sure that things are going correctly. Remind the staff that you have to have patience with your patients. Some patients genuinely struggle. Some get nervous about being at the doctor's period. Some of them are specific to the exam that they're taking. So taking that comforting, reassuring approach with your tone and just how you treat people is going to make all the difference. And lastly, you can put a collective team commitment on exam schedule accuracy. So just making sure that your team knows what's happening, when it's happening, knows when their patients are coming in.
And now we're going to talk a little bit about scaling these best practices, whether you're a new practice growing rapidly, you're growing your patient base, or you're a multi-location practice, or maybe a bigger healthcare system. The question becomes how to scale consistently to ensure repeatable and high quality patient experiences. As practices grow, they're expanding to multiple locations or they're operating within a larger health system. The challenge isn't just about doing more tests, it's about doing more tests consistently and with the highest quality. Scaling visual field workflows effectively means ensuring every single patient receives the same standard of care, regardless of what technician is administering the test, what location they are, even what day So my first piece of advice on scalability is to standardize the protocol. You want to develop clear and concise protocols. You want to document every step of the visual field process, from patient check-in to test completion and result transfer. You want to define how patients are prepped, how instructions are given, and how the test is initiated. For new practices, this may be your blueprint, and for multi-location groups, it could be your standard operating procedure. Next, you want to implement centralized training. Ensure all technicians, whether they're new hires or their staff from different sites in a larger system, you want to ensure that they're receiving identical high quality training. This reduces variability in test administration. We know some techs are having a good day, some techs are having a bad day, and that can affect how the patient is tested and then can ultimately affect the results. We want to make sure that every test is administered the same. You want to consider either recording training, or you can have like your superhero tech, maybe your lead tech, they can be responsible for making sure everyone is trained up in the same way. And then lastly, you want to conduct regular competency checks. So review your technician's performance. This could involve reviewing reliability indices and just making sure they understand the test that they are administering. You want to actually observe them administering the exam, and you want to conduct peer-to-peer checks. Let the technicians check each other. Consistent training and feedback loops reinforce best practices across the entire team. And finally, for truly scalable and consistent quality, centralized data management and easy accessibility are non-negotiable. One of the things that can go into that is using a cloud-based platform. Make sure you have a cloud-based platform. Modern visual field solutions often utilize these cloud-based systems. We certainly do. As we talked earlier, this means all test results, regardless of where or who performs them, they are immediately uploaded to a central secure platform, and they aren't stuck in one single machine. This is vital for multi-location groups wanting to compare data across sites, or for hospital systems with distributed clinics, especially if your clinics are closer in location and maybe your patients follow a provider and they're at different locations. You want to make sure that you're able to access all of those reports from anywhere. Also, having an easy EHR or EMR data upload. Ensure your chosen technologies reports can be added to your existing electronic health record or your practice management system. You want to make sure that you can easily integrate those reports. And of course, you want to centralize review and progression analysis. The ability for the doctor within the system to access and review a patient's entire visual field history, including the progression analysis from any location, it really ensures that there's consistent diagnostic oversight and management. This allows for standardized interpretation and treatment plans across all points of care. So if all of the doctors are able to review all of the information, hopefully they're able to come to the same standard, or the same conclusion, and then the standard of care is shared across all of those providers, whether they're in different locations or not. And the last thing I kind of add here is, visual field workflows, they're an ongoing process. They require continuous monitoring and optimization. So by embracing standardized protocols and leveraging the advanced visual field technology and ensuring there's robust data management, really practices of any size can grow their patient base while still having this consistent, high quality, reliable visual field testing. This ultimately leads to better patient outcomes, more efficient operations, and of course, your patients will come back and continue to grow your business.
And no conversation around efficient eye exams of any kind is complete without discussion on billing. So we'll touch on that a bit. Ensuring proper billing and meticulous documentation for visual field testing is not just about maximizing revenue. It's fundamental to audit protection, compliance, and demonstrating the highest standard of patient care. Inaccurate or insufficient documentation can lead to denied claims, recoupments, and significant compliance risks. So here's an expanded look of how eye care practices can master billing and coding. First, you need to have a deep understanding of the CPT codes and medical necessity. So knowing your codes and familiarizing your team, particularly technicians or billing staff, with the specific CPT codes for visual field testing. We have code 92081, which is visual field examination, unilateral or bilateral with interpretation and report. So this is your basic or limited assessments. We also have 92082, which is a visual field examination, uni or bilateral with interpretation and report. Intermediate examination, so pattern specific 24-2 or 30-2, but probably not a full threshold. We also have 92083, which is a visual field examination, unilateral, bilateral with interpretation and report extended examination, including perimetry of the entire visual field, and 95919, which is qualitative pupillometry. For more on how to properly bill for visual field exams, Jessica is going to drop a couple links in the chat to some blogs with more detailed information available on our website.
When I am onboarding, I always have I make sure I have just a couple minutes to always just stress how medical necessity is really important for billing and coding. The diagnosis codes, so the ICD-10 codes, should directly support the need for the visual field tests. Every visual field test must be medically necessary, of course, for it to be reimbursed by your insurance carriers. This means there has to be a clear clinical reason for the test was performed, and it cannot be a routine screening unless there's a specific indication. If a patient's coming in with 20/20 and no really cheap complaints or anything like that, it's not really routine screening to do a 24/2. Patients that are at risk for glaucoma. Maybe you're monitoring a known condition, or patients with symptoms that suggest neurological issues. These should directly support the need for the visual field test that you're administering. And you want to document your procedures to mitigate audit risk. Relative to reimbursements, documentation is your primary defense in an audit. Every visual field report in the patient's chart must include these things. One is the reason for the test. You need a clear indication for the medical necessity of the test. You have to link it to the patient's chief complaint, their diagnosis, or a follow-up plan. An example of this may be the patient presented with an elevated IOP, test aims to rule out glaucoma. Number two is the test type and parameters. You want to specify the exact test that's performed, whether it's a VR visual field 24-2 or any type of test. You want to specify what test you administered. Third, you want to let us know who administered the test. You can include the name or the initials of the technician, but we need to know who administered the test. You need to talk about the reliability indices. You want to note these. These are highly crucial. You want to include and comment on the indices. For example, your false positives, false negatives, the fixation losses. Unreliable tests, though they were performed, they may not be reimbursable. You need to either justify why the test was unreliable and why the test, couldn't be repeated, or you need to show some type of attempts to retest. And then lastly, you need the interpretation and report. This is the physician's or the provider's professional component. And this in itself has to include when the provider reviewed the results, a statement comparing the current results to previous results. You want to note the stability, improvement, or progression of whatever you're following, how the visual fields results correlate or don't correlate with other clinical findings. You need a clear statement on how the visual field results influence the patient's diagnosis, their treatment plan, or their follow-up schedule. This is really vital in demonstrating the test's medical necessity. And then you need to sign it, of course. And then for more on protecting yourself from audits, I believe Jessica is going to drop a link in the chat for a blog with more detailed information, of course. And then a few more thoughts on optimizing your billing practices. You want to link diagnosis codes to your CPT codes. You want to ensure that the ICD codes on the claims directly justify the CPT code for the visual field. For example, our glaucoma diagnoses, they're usually around like G40s. They can support 92083, but a simple refractive error may not support 92083. You also want to check the local coverage determinations, your LCDs. Medicare administrative contractors often have specific LCDs for visual field testing where they're outlining covered diagnoses, how often you can run these exams, and specific documentation requirements. Adhering to these is non-negotiable. If this is not met, you will not be reimbursed. You also want to avoid global period conflicts. Be aware of global periods of surgical procedures that might bundle visual field testing. I believe you can't start charging for tests until sometimes it's 90 days post-op, but you want to make sure that you're not performing results, and then trying to bill them separately when they should be bundled with the post-surgical care. And then separate billing for bilateral tests. While 92081, 92082, and 92083 are inherently bilateral codes, which means they cover both eyes, some payers may have specific rulings for reporting. So you always want to confirm with your local administrative contractors. And of course, the last topic we should cover when talking about billing is audit preparedness and how the technology you choose can help with your documentation. You want to conduct internal audits, regularly performing internal audits on your visual field charts and claims to identify and correct any recurring documentation or billing errors before the auditing occurs. You want to self-correct as soon as you can. You want to provide staff training reinforcement. Ongoing training for all staff involved in visual field testing and billing is essential. You want to make sure everyone is updated on CPT and ICD-10 codes, on the payer policies, and technology should be covered in these reinforcements. And then you want to leverage modern visual field technology with automated data capture of key data points like reliability indices, test types, patient responses, as the automation reduces manual transcription errors. The more your technology can do, the less human error and also just time. You want your technology to do as most as it can. You want standardized and easy to read reports. This naturally includes the elements required for proper documentation. So you want to make sure it's not only giving you everything that it needs, but it's done in a way where you're not having to put things together for you. It's just giving it to you in a nice and black and white for you. And then also progression analysis tools. These tools help physicians systemically compare current and past visual fields, making the comparison to baseline component of the interpretation is much more robust and defensible. So having a system that is going to pull that up for you, it's going to show you this is the patient's first report versus this is their most recent report, just makes it a more robust way to kind of interpret these results. And then I will call Kristen and I some pros. I feel like after you've worked as a tech for more than 5 years, you're kind of a pro. So we want to just talk about some do's and don'ts. So things that you do want to do, you want to designate a dedicated tech champion during onboarding of new technology. If you are a larger practice, you have multiple technicians that maybe rotate to different locations, you want to make sure you have one consistent technician that has the ability to talk to all of the other technicians. You want to make sure that they are onboarded, especially so they can train people who are maybe missed training or new hires. You want to schedule your visual fields during pre-testing. Surprise testing can really push your schedule back. So take some time to go through the schedule and just make sure you are accurately scheduling the visual fields when they should be. And then you want to run the test during provider consults. You don't want any downtime. Just if you have the ability to run a test, just go ahead and do it.
Something you do not want to do not overcomplicate your workflows. Short and sweet, keep it as short and sweet as you can. Don't make it too tough. Don't make it too many steps. Do not undertrain your staff. I feel like lately we're seeing a lot more of people joining eye care practices who maybe don't have eye care experience. It is crucial that you take the time to educate them on what they're doing and why they're doing it, how a technician interacts with a patient during an exam, during a test, the instructions that they're giving all have such a great impact on the results that you're getting and how your patient is understanding and how they're going to move forward with care. So make sure that your staff is trained properly. And then don't forget to align documentation with test type and ICD-10 codes. This is super important to do it as it's happening because it's harder to go back and remember you're seeing so many patients a day. If you're not taking your notes and connecting these dots while they're there, it may be hard to go back and remember and chart properly.
All right. Thank you. Thank you, Kristen. Thank you, Torri, for sharing your wisdom and advice on mastering visual fields. I have been monitoring the Q&A panel, so we do have some questions, and I think we have time for just a few of them. We will share any that we're not able to answer today in our follow-up. But Torri, Kristen, whichever one of you would like to answer this first question, how long does it typically take in your experience for a practice to fully integrate virtual visual field testing into their daily workflows? So that question is on the virtual visual field side.
I feel like for customers that are already conducting visual fields daily, it really takes no time. They're just changing the tool that they're using. So right after onboarding, they just immediately start using the headset. So I want to say it's right away. For customers that haven't completed, any type of visual field testing in the office, whether they're a new practice, maybe this is a provider that just went out on their own and they have brand new staff, they're opening a brand new location. That lead time can just take a couple days. I really just want to say once they feel comfortable in just a workflow in general of once they get their check-ins and their staff trained up, that can take like 1 or 2 days. Really, onboarding takes 30 minutes. The headset is extremely easy to use. And really you just want to, it's more so on the staff. You want to make sure that they're comfortable using a headset. But once they're onboarded and they see how easy it is, it really takes no time at all.
Excellent. Thank you for that answer. Next, are there any CPT codes that providers commonly underutilize or maybe misunderstand when billing for visual field exams?
I think that
There
9202
is
code is underutilized.
Kristen, I
It's
think you were going to
exactly
add
what.
something.
Yeah, that's exactly what I was gonna say. There's a lot of states that, like for driving purposes, will call for this exam, for those special licenses. And a lot of practices don't really know that they're actually able to go for those exams. Additionally, there is a, offering on virtual field, a C40 exam. It is a, screener, but there's also certain diagnoses that qualify this screener for being billable.
Excellent. And one last question, because I want to leave time for our poll. What happens if a patient doesn't complete the test properly? How do you handle retests?
It's a good question. First, I would consult the provider. Of course, if I was the technician, and you really want to just assess why did they not understand it? Um, are they physically unable to click a button? Did they just not want to do it anymore? Sometimes patients can get frustrated and they just give up in the middle of the test. So you really just want to understand why they weren't able to do it. If they were frustrated, just try another day. If they're on that's on bilateral treatment, just try it at their next visit. For those really extreme cases, maybe just do one eye a visit. If they come back pretty often, if they come back like once a month, maybe do a right eye in 1 month and a left eye in the next month. For especially as patients start to age, you really just want to be mindful of their time. And you don't want to do anything that's overbearing for them. You want them to come into the office and feel like they're being taken care of and it's not a dread. You want them to kind of look forward to coming and seeing the staff, and they're so nice to me and I do have to do this test, but at least they're really fun. So you want to just really explore what the root cause of them not being able to take it. If it's something that's physical, that's something that you really can't control. But any other type of factor, you want to see if there's anything you can mitigate and really just maybe get rid of that anxiety or just make it a more pleasurable experience for them.
Excellent. Another great answer. Thank you so much. I think that's all the time we have for questions. There are a few more, so we'll make sure that we include them in our follow-up. But quickly before we wrap, I do want to ask two poll questions. So I'm going to launch our poll here. All right, so everyone should see two quick questions on their screen. The first question, what is your practice's biggest challenge when it comes to visual field testing? There are a series of answer choices here, so please select the one answer that you feel best resonates with you as your practice's biggest challenge when it comes to visual field testing. Knowing your feedback will help us create future educational content for you. And lastly, if you'd like to schedule a commitment-free demonstration of our virtual field device with a member of our exceptional team, please let us know that by selecting yes at this time. So I will give that just another second. As I say thank you, I want to end with a huge thank you to Kristen and Torri, our presenters today. Thank you to all of you who attended. Yes, we'll send a copy of the slides and the recording to all registrants. But most importantly, thank you to all of you for being Vision Care heroes. And we look forward to you joining us again for future discussions. Take care.
Thanks, everyone.
Thanks. Bye.